Hi, my name is Leslie Torres, and my topic is human salmonella infections linked to live poultry and backyard flocks. Step 1, gather background information. Salmonella is a group of bacteria that commonly cause a foodborne illness called salmonellosis. More than 2,300 types of bacteria are in the Salmonella genus, and some of them include Salmonella enteriditis and Salmonella timurium, which are the most common strains in the United States. And infection happens when water or food are contaminated with the bacteria and are then consumed. Step 2, analyze the current situation. Epidemiologic and laboratory findings trace the source of the outbreak to live poultry located at Mount Healthy Hatcheries in Ohio. Weaknesses is Mount Healthy Hatcheries in Ohio was the same place associated with salmonella outbreaks in 2012 and 2013, also due to live poultry. Opportunity is creating better health protocols for facility inspectors to follow during inspection checks and bringing awareness to the public. Threats include infected live poultry going unnoticed due to weak inspections and unclean conditions. Step 3, prioritize issues. In 2014, a salmonella outbreak occurred, infecting 363 people in 43 states, including Puerto Rico. 33% of people were hospitalized, but fortunately there were no deaths reported. And from the map on the left, you can see that more cases happened on the East Coast. And public awareness is a priority because the more people that are aware of how salmonella spreads, the more likely they will be to take necessary precautions to protect themselves. Step 4, analyze alternatives. Approach number 1, making sure people properly sanitize themselves after interacting with live animals. And this includes not having direct facial contact with the live poultry, maintaining clean living conditions, and washing their hands after interacting with the animals. Approach 2, educating consumers to properly clean and cook food before eating, and this includes just thoroughly cleaning and making sure the food is cooked before. Approach 3, spreading awareness of salmonella and the risk associated with it at grocery stores, places of work, and school. And the last approach is making sure facilities are aware of the risk by implementing proper protocols. Step 5, provide recommendations. So the first recommendation is possible buyers of live poultry should have health-related information provided by hatcheries, and this information should include the risk of getting salmonella from contact with live poultry and associated human risks. 2, stores that sell or display live poultry should implement interventions to prevent salmonella contamination in their products, and interventions such as having a sanitation program integrated into the hatchery operation. 3rd, if salmonella has reached grocery stores for whatever reason, companies and stores should immediately recall any products that may have come into contact with the infection. And the last recommendation is biosecurity should be enforced to help reduce the risk of disease like salmonella having contact with live poultry. 6, establish action plan. The action plan is to not have producers sell live poultry that may have come from unsanitary living conditions, thus raising the possibility of being contaminated with salmonella. By 2021, the Food Safety and Inspection Service should identify salmonella as an adulterant, which is a food that is unsafe to consume. By 2023, educate and hire public health workers specialized in identifying unsanitary conditions to inspect factories where live poultry is being prepared to be sold. And by 2025, analyze the number of salmonella cases in the U.S. since it was deemed an adulterant to see if there has been any improvements. So step 7, conclusion. In my opinion, there needs to be more rules implemented to prevent salmonella from spreading to live poultry and to other food sources. I grew up with my dad always telling me to make sure I cleaned and cooked any food because of infections like salmonella, and because of this it should be made aware to consumers of possible risks, and extra precaution is always better than having none at all. So like the precautionary principle is to be better safe than sorry, and I think that's something that should be implemented more.